Welcome to the session on selecting a research topic and review of literature. I think all of you, sometime or the other, must have thought of doing some research in the clinical area or some other area which was of interest. But in the beginning, you may find it difficult which area to select. What is my topic? How can I select my topic? With whom I can discuss, and what is the need of the research? These are some of the questions the beginner researcher always asks, and they are little confused. But this is a normal process. So, in this session, we will try to understand how you can select a topic and why there is a need for review of literature or literature review in the beginning. When student nurses or any student wants to do a research, they cannot think of any topic. They think all the topics are being covered. From where should I find a new area for research? And they do not know how to proceed. So let us see how to proceed for the research problem first. If you decide to do any research, it is important that interest area should be of interest to you. Suppose you are working in ICU or operation theatre or labor room. You can select some broad area from that unit only. Discuss with your colleagues or friends. What I am thinking will be of interest, will be of need, or can I do something different? Discuss with your unit head, with your hospital. If you have a research unit or CNE unit or your nursing head, you can discuss your topic with them also. Read various theses and journals available, and sometimes you may assess there is some need of the hospital also to conduct research in some particular area. So, it's very important in the beginning, read the journals, thesis, unpublished papers, unpublished abstracts, souvenirs, attend conferences, seminars, because then you will come to know what are the latest trends and what I can do for the patients. Your experience, observation in the clinical area will also help you. If you analyze the data, if you read the patient's case sheets, something new you can do. What are the latest health issues, national programs, and various other things? You can combine all these things and jot down some of the broad topics. So, first of all, select some broad topic of the research. That's very important. Otherwise, how you will review and what you will review. So, broad area, it can be newborn care, it can be care of mother during postnatal, or anything whatever is of your interest. Then literature review is the very essential and the first step. Already I have told you what all things you can review, because you want to know what is already being done and where are the gap areas and what new you can do. Narrow down the broad area and write a topic. Then again you review the literature. Then write a research problem. Selecting a topic is a very creative process. You have to critically think about what is already being done. Where are the gap area? What is the need? What is the justification of this new thing what I am going to do? And it is of the interest to the reader, interest to your hospital authorities, and interest of the patient and the profession. Then write down some of the ideas of the broad area. Out of that, select one or two broad area. Then again narrow down to a topic. Then narrow down to a research problem. So that is a actual process of selecting any research problem. For example, broad area can be heart failure. You narrow down to use of the beta blocker medications in the treatment of patients with heart failure. Or another topic can be side effects of chemotherapy in case you are working in palliative care or the cancer unit or where the patient comes for the treatment. You must have seen patient having nausea, vomiting, loss of appetite. They are very apprehensive, and the present intervention is not reducing the side effects of chemotherapy. So you have an interest that you want some new intervention, that patient condition is improved or the side effects of chemotherapy is reduced and patient feel comfortable. Therefore, there is need to investigate a new intervention so that these symptoms can be reduced. So your aim is to reduce the symptoms of the patients after the chemotherapy. But now you have to find out the studies, what is the impact of the going on present chemotherapy interventions, why it is not reducing the side effects, and where are the gaps, what are the recommendations by the previous studies, and what new you want to do. Is there any study carried out in that particular with the particular intervention? Then you will study that also. Sometimes it may take long time to finalize your topic. Don't worry about that. It is a normal process with everyone. Discuss with your colleagues and with your department head. Suppose you want to do in a particular area, you can go and discuss with your colleagues working in that particular area, or the senior medical officer or the consultant also. They may help you to finalize your problem, and sometimes you may have to take them as a co-guide, a co-partner author also, so that you can do clinical study in a very systematic way. And the clinical component, because when you give a nursing care, medical treatment is part and parcel of the patient care. Explain the need of the study. Very important is give the justification and arguments with review of the literature. That is very important. You cannot just say this is my experience. Experience is one part. Your observation is one part. You can strengthen it, your justification with the data. You can take the data with the permission of your hospital authorities. If they allow, you can give your statistics. Why you want to do this? Statistically, you can give the justification. With the broad area topic, there are many research problems. But now you have to identify what will be your one research problem which you want to do and try to solve it. That is very important. Problem statement. A good problem statement is well structured. We have to see it is clearly stated with the variables in that. Problem identification can be what is wrong with the current situation. What is the context of the problem? That means you have to give the background of the problem. Scope of the problem. How many people are affected with that problem? If you do this research, will you be able to find some solution so that the patients are benefited? In the society, in the community, how many people will be affected or will have the benefit of your intervention? Consequence of the problem, that is, what is the cost of not solving the problem? Suppose the side effects are more and patients are coming for those side effects for the treatment, and cost of treatment is going high. So you have to see from that point of view also. If you find a solution, will it reduce the cost of the treatment, or patient will not readmit or will not come again for the side effects or for the same problem? Knowledge gap. If you do this study, will it bring in some good new evidence or increase the knowledge? Proposed solution. How will new study contribute to solution of the problem? So these are some of the questions which you need to answer when you finalize your research topic. Suppose there is one more topic, health needs of elderly in the selected urban community area. So you can say assessment of prevalent health needs of the elderly with chronic health conditions and utilization of health services in selected urban community of some particular district or a state. Why you want to do this study? You may say there is national health program. Government is putting so much of emphasis on the care of elderly, and all the districts and the states have a elderly clinic in the hospitals. Public health in the community, there are services are there. ASHA, CHO is providing the services. So you want to see, or in the health center in the urban areas, urban public primary health centers are providing these services. Are elderly able to utilize these services? What are the various problems they are suffering? What are the factors that is actually affecting their health? And then on the other side, if services are available, but OPD attendance is very less, why people are not utilizing those services? What are the factors? It is financial factor, economic factor, family support, or what other factors, transport, communication, or they are not even aware of all these services which are available near their home. So these are some of the areas like this you have to analyze first. Then you will finalize your topic. So critically you have to then analyze your research problem. That means, what is the research problem? Is the problem clearly stated? Does the problem build an argument for new study? Does the problem have significance in nursing? Is research problem compatible to chosen research paradigm or methods? Very important to understand and answer these questions. What is PICO? Your problem statement should have population or patient or problem. There can be an intervention or there can be a comparison group. Comparison means you want to compare two interventions and see which one is better, or you want to compare a standard treatment and see your new intervention is better than the standard treatment what is already been given to the patient, and then the outcome. PICO helps in clearly specifying your problem statement or the research question. It is achievable research problem. Can we achieve it? Can I solve the problem? All the research elements to be operationally defined for interpretation from researcher's point of view. All elements of PICO may not be there in all the research problem. This I will explain you. Elements to be operationally defined means if you are studying health problems of elderly in selected community area, so you have to, not the dictionary meaning, you can read the dictionary meaning to understand, but you will give the definition of what do you mean by elderly in your study. What do you mean by health needs of elderly? Which community? What is the health utilization? You mean all these definition, all these variables needs to be defined in your words, because when you define these words, they should be reflected in your data collection tool. Then only you will be able to collect the data what you want to collect. Now you can see in this table the PICO means population, patient or problem is P. What is the study population? So you have to identify what is my study population. It is elderly, it is cancer patient, or it is nurses, whatsoever your population is. Maybe patient with the cancer. Intervention or the treatment I. Which intervention or treatment is to be given? So you have to decide in your study what intervention, new intervention you are going to give. Specify the new intervention. It is chemotherapy, it is radiotherapy, it is from alternative medicine. Whatever your intervention is, it has to be specified. Comparison, that is what is there for comparison. Alternative if any or standard treatment. Outcome, What is the effect of the intervention? Side effects. If there are any, the side effects are being reduced with this intervention, or they are increased, or there is no change in the side effects, and quality of life of the patient is improved or not. So in this you will see, in every problem statement there will be population and outcome. Everywhere it will be there. But in the second there can be PIO, there can be PCO, or there can be PICO, all the 4 components. Again it depends upon your problem statement. What is the characteristics of the research problem? It has to be novel, relevant, clear, interesting, feasible and significant. Why feasible? Feasible in terms of time and the cost. That's very important to see. If you are doing alone, then you have to see how much time you have, how much money you can spend. So your intervention depends on your time and the money also. If you are getting any funding from any funding agency, then you can think of what are the requirements of that funding agency, what is the requirement of my institution, and how ethically I can do this study. Then review, literature review, a most important thing. This is the first step any researcher will carry out the literature review. Why it is important? Let us see. Literature review is a compilation, classification and evaluation of what other researchers have written on a topic. This is not only a study, but it is compilation, classification and evaluation. If you read any study, every researcher give review of literature in their study. So you will come to know so many researchers have done this study and what is their outcome of that study. Literature review is an academic writing demonstrating knowledge and understanding of the academic literature on a specific topic. Literature review is also a critical evaluation of the material. That is why it is called a literature review rather than a literature report. Why? Because we critically analyze what is already being done, what are the needs and justifications given, what are the findings and outcomes and how they have justified their findings and data and the findings and recommendations for the future. So it is every paper is critically analyzed by every author. So you will also critically analyze that every article, and then you will understand what is the need and shall I select this topic or shall I select this review for giving justification for my study. Literature review is very crucial step in the beginning because you will find out the gap areas, available evidence and arguments for new study, need and justification for new study, even whatever the limitations of that study, what research methodology was used, and what recommendations for future is being given by the author of that study. That will help you to conceptualize your own study. This literature review also tell the readers who will read the article current knowledge about the topic. You can give justification. These many studies are being done in these many years and this is the current knowledge which is available. But now these things have changed and the present study will bring in the evidence for whatever you want to do. Gap areas. No study is evidence is forever. There can be some gap areas in methodology or in the sample, or the sample can be small, or something new has come. Now you want to see there is an evidence. What is going on is much better than what is being given in the latest, all the old studies. or you have some idea in your mind that some new intervention can bring in change in the practice or care. So that argument can be strengthened. What is the significance of this study for the patients, for the community, for the society and for the profession? Will it reduce the cost? Will it reduce the stay of the patient in the hospital? Will patient will not have complications or it will reduce the complications? So these are the significant points which are to be answered. So there are two sources, primary source and secondary source for review of literature. Primary source is, suppose author A has written the article and you are reviewing that. That is a primary source written by a researcher themselves. Secondary source is author A has given citations from different studies. So those studies become the secondary source for review of literature. You can see in the references those all studies and find out the primary source and go through in detail about the studies. So review of literature is collective body work done by various scientists and authors which are published in the form of theses, books, articles, case studies, monographs. Every scientific investigation starts with literature review. Always remember this point. Literature review is an essential part of the research process which help to generate ideas, help in developing questions and instrumental in process of research design. So literature review has to be done very systematically and it takes time. You have to be serious when you do a literature review. Review must start with selecting a broad area which already I have told you. Researcher collect and analyze and interpret the findings of all the studies which he or she has shortlisted. Summarize the findings so that you come to know that what justification I can give for my study. It is important to do up-to-date literature review and start from the latest studies. Nowadays it is being said if studies in that area, particular area, so many studies are being done, maybe that evidence will be prevalent only for 5 years. But if it is a rare study, maybe 10 years or in rarest cases, evidence stands for 15 years. Conduct the review. You always have to plan your review. Conduct a review systematically. You should have a inclusion and exclusion criteria should be clearly mentioned in your beginning. That means if you have inclusion and exclusion criteria and plan it systematically, any other author, if they follow your step, they should also be able to get the same findings what you are able to get. So you should have a strategy to locate the studies. Good search skills are very important. You should be good in searching the literature review, from where to search, how to identify the good studies, what is the criteria I have to keep in mind while selecting the studies. Identify some of the footnotes which are given down in the studies and you can search as those studies also and review. Delimit your studies. That is, suppose you want to study from 2014 to 2024 your studies. It has to be only in an English language or it has to be in other languages also. Your timeline, languages, your independent dependent variables, all these has to be planned beforehand. Searching for reference through bibliographic database. You should know which all database are available and from where all I can collect the studies. Citation from relevant studies need to be acknowledged and they have to be seen that you track these from these databases, and nowadays these databases are available online, on screen Manuals are available. You can go through the tutorial manuals and learn because they are very user friendly and menu driven are there. So you can select the topics, delimit the time period, languages, variables, everything you can do if you go through the tutorials of this database. It can be PubMed, Medline, any other database whichever you think you want to go through it. It is very important you should first understand what are these database and softwares available. Use tutorial always first. Restrict or expand the menus you want to variables and the words you need to put in as per your research problem. Identify the keywords in the problem statement. If you will not identify the keywords, there are endless studies are available. Then you will get confused why so many studies, which study to be selected. So be specific. In quantitative studies, you can have independent and dependent variables. In qualitative studies, the central phenomena what you want to study or the population, you can take either of these. So steps are: select search area, analyze and select the items you want to associate with, formulate a research strategy, make a note of words and phrases, look for available sources and decide which one is appropriate. Begin search keeping in mind the records, you should keep a record of your search. A set of predetermined guidelines which already I have told you is very important to write it first. Start grouping the information, make notes, identify themes, then you can group the information and code the references to avoid the plagiarism. This is very important. How you write a review? Literature review should begin with an introduction which will give the introduction about the area and why you want to do. The main body of the literature review, what are the conclusions you find from these studies? Summarize the findings and include references list and the authors. Then you summarize it at the end. The table can be there with the author, characteristics of design, data collection approach and key findings, so that at a glance you will come to know what are the major findings and in which country, in which year these studies are being done. So database, very important database for nurses are Cumulative Index to Nursing and Allied Health and Medical Literature on online. So we can summarize. Very important is select the broad area. You have to do extensive literature review. Narrow down your broad area to the topic. Select one or two topics, then convert into a research statement or a problem. Keep in mind the PICO, that is your problem or a patient, intervention, comparison and the outcome. It depends all the 4 components or the 3 components. Then do the extensive literature review. Have a strategy in the beginning for literature review and see that how you can analyze your finding and do a good research by selecting a need-based research problem. Thank you.